Hi, this is Dr. Paul Steinke, CGH's President and CEO. Thanks for having me join you again today. I wanted to give another update on where CGH is at in the community with the whole coronavirus issue. So I do want to express my supreme appreciation to both employees and to the community for the efforts that are being made to get through this. From the standpoint of our employees, this is a difficult time, and hopefully not one that we'll be experiencing anytime again soon. It's one thing to sign up for a career in healthcare knowing that your first priority is your patients. It's another thing to know that your own health and safety, or the health and safety of your family, may be at stake. So from an employee perspective, the odds definitely are of a different nature than the rest of the community. So I thank you for accepting that challenge and meeting it. We are getting through this day by day and week by week, and there is an end in sight. To the community, thank you so much for your support and your donations. Last time I named specifically some businesses and individuals that had made some donations, and I want to do that again today. In addition to the list last time, I wanted to call out Rock Falls Elementary District 13, GPN product donations, Tim Pope, and various other anonymous donors. Thank you so much for the donations and support, dedication that you all are showing for CGH. There's a couple things that I think as the public you probably have some questions, such as, is it safe to come to CGH? Is it safe to come to the clinic to see my doctor? We are taking all reasonable steps to ensure your safety. I've shared this with our employees, but in a lot of respects, I feel safer coming to the hospital or the clinics than I would other places in public. I know that everyone that comes through the door is screened. I know that the place is cleaned to very strict and high protocols. We have a very regulated environment with temperature and humidity controls, air exchanges. We know that the surfaces are wiped down, and so I feel very safe and secure here, and I hope you will too. When we do open things back up to more regular operations, you'll notice things such as the chairs in the waiting room will be spaced far apart. We will purposely have our physician schedules lighter to avoid any backlogs or groupings of patients in the waiting room. We will be cleaning the chairs after you've waited in the waiting room, and we'll be wiping down the surfaces in your exam rooms on a frequency that we've not previously done. We're taking all necessary steps to try to make sure that you are safe when you come into the hospital or the clinics. So we look forward to that. So we still encourage you to call your physician's office if you have a more urgent need. Testing for coronavirus and an assessment for a possibility of a test is still available at our ReadyCare clinic. One other new feature, both through your physician's office and at ReadyCare, is the possibility of a virtual visit with your smartphone or an iPad or even on the telephone. If you call your physician's office and if they feel that a visit is necessary, they may recommend you come in, but they also may offer you a televisit. And that's where the camera on your phone or your iPad can be used to communicate directly with the physician, and a visit can be done in that way. What we don't want you to do is to delay any care that you may need. We have scaled back on elective surgeries and elective procedures and elective visits. There is a point at which those things that used to be elective now become more urgent. Our doctor's offices are open, and we are available for those more immediate or urgent needs. So don't delay the care that you need. Is the ED still open? So I've had lots of people ask me about the tent that is outside our emergency department. The tent was put out there as a way to help assess people that may be coming to see us for coronavirus. The volumes in that tent have been very, very light, thankfully. But please don't let the tent scare you away. Our emergency department is there to help with people who are severely sick, potentially with coronavirus. But more importantly, and more commonly, the emergency department is there for other emergent and urgent needs. We still have heart attacks, broken bones, injuries, other important things that are coming through our door every day. Having the tent there was a means of helping assess people that were coming in with potential coronavirus to make sure that we were keeping everyone safe. It is not an indication that the emergency department is closed or that CGH is overrun, because we're not. Don't delay, especially emergency care, but don't delay urgent healthcare needs either. So free counseling by phone for CGH patients, along with all the other things that may require counseling. This whole coronavirus pandemic presents its own set of challenges. And understandably, it can create a lot of fear and anxiety and depression, things that can really get you down. We do have counseling that is available for those sorts of needs. The Ways to Wellness program is a program in place that does provide a counselor that's available by phone. So please keep that in mind if you get to that point where the situation seems overwhelming and you feel like you need to talk to someone. Since small town spread is slower than heavier populated areas, would that also translate into the virus lingering here longer? And again, this is my 2 cents worth. My guess would be that it wouldn't linger longer. It actually would be done with us quicker. As we have the ability to truly social distance more than, let's say, if you lived in a city that you needed to get on the subway or a bus, we have the ability then to shut this virus down quicker than a city would. So in closing, again, I want to thank you for your time today. Extend a thank you to all of our community members that have been so supportive, the businesses that have made donations, the restaurants that have given food, but most importantly, for your thoughts and prayers. We can't do this without you.